Our visit to the Udmozi Children's Palliative Care team happened in July, and we went out for a week. The objective of the visit was to scope out what our partnership could be in the future, because we felt that a face-to-face was the only constructive way to actually do that. We also brought out 2 training strands. The first strand was a reflective practice piece. This was a tool that we developed at LauraLynn, and we call it clinical debriefing, which is a practice development tool post-death of a child within the hospice. Now, we didn't want it to be used just for that, but we wanted to actually give the team something very concrete from an educational and practice development perspective that they could take away with them. The second training strand was introduction to adaptive play and the whole concept of memory making within children's palliative care. So they were the tools that we brought with us. It was a bit nerve-wracking. We wondered, would they be on the same wavelength as us? But we got some very positive feedback when we were there. The main challenges for the Udmozi team, a lot of you have mentioned all of these things before us, the profound lack of resources and all of the challenges that brings with it, whether it's related to poverty that the families are dealing with, and this kind of presented itself from a children's palliative care perspective in different forms. And one of the forms was that extensive stays in hospital, children who had diagnosis, there a lack of finances to be able to get them transport, to get them back up to their community. So therefore you were dealing with different palliative care challenges within the hospital kind of structure. The challenges of limited community support, and we found out while we were there that that's what the team would like to develop in the future, to actually train people to move into the community outside of urbanised areas, to refer children back to the main centres. So they had a very clear idea of their own challenges, and again, I suppose somebody else has said this about listening, and that was really what we did when we were there. Overcrowding in the hospital, that was a challenge, and poor infrastructure. And also, I suppose, cultural differences. There was a large concept when we were there that famine was coming, and this was very much on people's minds, and they mentioned this quite a lot, and mentioned about, that this wasn't the busy season with regards to infectious diseases. So there were a lot of different challenges already.
And then just moving on to the strengths and opportunities, I think we were both kind of really overwhelmed about how integrated kind of palliative care and the concept of palliative care is within the acute setting, much more so than we find here. And our big struggle in the hospice is around trying to kind of get early referral and to build up that relationship with families before the end of life stage, and that's something that it's very challenging here because we have such a focus on kind of curative treatment, whereas over there, because there's less of that focus, the whole team were all geared up to kind of this sort of holistic approach, and even though the resources were so limited, the staff really wanted to try and meet the quality of life needs of the children, and they were really receptive to a lot of the topics that we presented, and thinking about if the child's last few days were on the ward, how could they make that as quality as possible, how could they help that family to create memories. And we were really kind of surprised and really blown away by that, because we find that such a challenge here. We thought it would be similar, and that helped us kind of identify the topics and how we could kind of expand upon them. And the team identified that the reflective practice tool would be something that they would like to develop in terms of their own staff support, and to try and prevent kind of team burnout and their staff competencies, and the memory making around the play, and how the team in Malawi might use that around kind of community integration, and how they can support the child to return back to their community was really important. And I suppose that was very overwhelming for us, because we weren't expecting them. When we went, we could see all these huge lack of resources and poverty and famine and all these challenges, and we were surprised to see, in actual fact, their palliative service was very progressive and very forward thinking, and that they were kind of really striving for that over kind of the other things. So.